Oh, dang it. Why am I so challenged with this? Okay, I'm calling the meeting to order at 11:35. And Julie, since you're standing, do you want to lead us in the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Okay, can I get a roll call, please? Oh, I gotta turn your thing on. You know, my goal for today is to actually do this right.
Berkowitz,
Here.
Butler, Ortiz. Axley,
Yes.
Trainier,
Present.
Winfrey, Newquist.
Here.
We have a quorum.
Okay, can I get an approval of minutes? Move
Second.
Winfrey, second Oxley. Roll call, please.
Berkowitz,
Yes.
Ortiz. Axley,
Yes.
Trainier,
Yes.
Winfrey,
Yes.
Newquist.
Yes.
Motion passes.
Thank you. Okay, moving on to old business. We have our sales tax and cannabis tax report. Okay, great. We don't have anything to other than the report itself. Does anybody have any questions? Okay, great. Do we need, do we vote that? I ask this every month. Do we have to actually, we don't. Okay, thank you. Yes, Destiny? Hold on, let me put your, okay.
Good morning. Thank you very much, Chair. I would just like to request that the recipients of the cannabis tax funds from 2025, as well as future recipients, submit a detailed report to this committee. These reports should explain how the funds were spent, specifically how they have helped our residents, and include data on how many residents have been served. Additionally, I suggest that we consider having an annual presentation at this committee to review the information going forward if committee feels like that's necessary. I just think that this process would promote transparency and ensure that the funds are making a measurable impact in our community. Thank you.
You're welcome. And I will take that up with the speaker and see if that is something that we want to bring forward in the future. Thank you. Anybody else? Julie, go ahead.
Thank you. And I'd like to comment and add a comment to Destiny's request. I do agree with that. I would like something a little bit further, however, as well. The committee, and I've been told it isn't a committee, there's a team of county board members that apparently decide how these funds are allocated. There's no set meeting date. It isn't an open meeting. I believe it should be an open and transparent process. I don't necessarily think two people on a board of 22 should just be able to allocate 250,000, give or take. So I would propose that we change the structure and then proceed with the recommendations that Destiny has come forward. I want the public to be able to hear our conversations, and then possibly we can reach out into the community even further and go beyond these organizations that we're very familiar with. We've got a lot of wonderful organizations that have received allocations, but they've received multiple allocations. So I know there's a lot of organizations out there that haven't had any input or support from the county. And I'd like to give them an opportunity to do that.
Julie, I'll make a comment and then Jackie. I believe that that is far beyond the purview of the finance committee. And that is probably a larger conversation that should be had since the finance committee did not set up the procedure in the first place. But I will also point out that we have voted on who to give money to. I mean, the group that you're referring to basically brings forward the organizations, and we have a board, as a board, have voted to fund those organizations. So for the grants directly.
It does come before us, but that's after the decisions are made, the presentations, or whatever type of application and presentation has been discussed. And again, it's on a team of 2 people out of a 22-member board. We have nothing to hide here. Why don't we do this in the committee? We should do this in the finance committee.
Well, I think you should
So
take this.
that is my recommendation. If the other 21 board members want to give their input, if they think that my suggestion isn't necessary, or I'm willing to hear the reasons, but that's my suggestions. That's what I'd like to see from this board. I think it's transparency and it's answering to the people who elected us.
Okay, well,
Sure.
thank you for your
Thank you.
comments. Jackie, let me put your, okay, go ahead.
We can all discuss who should be making these decisions. Maybe it should only be board members that have a cannabis facility in their area. There's a million different ways can be done, and it would be far more appropriate to bring this conversation up to the speaker or to the leadership for your party. But that being said, I just wanted to say Bolingbrook added one more contributor to the list. We have a new pot store. It's called Cookies. And I will say my son is right. He had a real problem with the name, but apparently this company has been internationally involved in this business since 1983, which was kind of a little bit of a surprise to me. But I guess maybe over in Amsterdam or some other places outside of the US, marijuana has been legal for a very long time. And they must have been one of the initial companies. So it was kind of interesting to see their concept and visit their store on their Chamber of Commerce ribbon cutting. But yeah, Cookies, I didn't appreciate the name much either. Cute, but I honestly thought it was going to be a cookie store. And then, and they do sell cookies. Hello, they do. They make cookies, which again, it almost feels like they're marketing to children. And I know this is not our issue. Maybe this is more.
I was going to say, what does this have to do with the county board, Jackie?
Nothing, but we're going to get some more revenue from it. And so that part is nice. But maybe this is something we should consider for our legislative agenda, that, you know, maybe we regulate a little bit more in Illinois on the advertising part.
Well, thank you for your comments.
Mhm.
We're not home rule.
Nope.
So I think,
Nope.
good luck with that.
Yeah.
But point taken.
Yep.
Anybody else? David, hold on, let me, okay, go ahead.
I have to agree with Destiny and Julie, because this committee doesn't discuss it and bring it to the board. And it goes to the board, they say it should have been discussed in committee. So I totally agree with their comments.
Thank you. Anybody else? Okay. Okay, moving on to number 2, appropriating stipend payments for elected officials. And Rashawn, can you do a little bit of explanation about this? And I believe you have an amendment that you want to request also.
Yes.
Thank you.
Good morning, everyone. So this is part 2. I know this resolution or appropriation came before you last month, and this appropriation is the remaining elected officials. I do have an amendment to add the county clerk to this. So it would be adding the county clerk, and the total amount would be $19,500. And adding the $6,500 to that.
Okay, does anybody have any, oh, well, actually, can I get a motion and a second? To appropriate stipend payments for elected officials, number 2 on, okay, well, Denise motion, so you're gonna second? Okay, thank you.
There's a motion and a second on the floor.
Okay, wait, I'm sorry. We do need the amended because that's my fault for not asking for an amended motion. Right, okay.
other.
Stipend, correct. Okay, so Jackie is making a motion you're making a motion to pass this as amended. Just making a motion to amend the resolution. Okay, now do I have a second? Denise seconds. Okay, we need a new roll call because Mr. Butler's here. Go ahead, yep. Pardon? Oh, I'm sorry. I thought I had you on there. Oh, that's Jackie. Okay, no? Hold on. What's seat number 12, right? There we go. Okay, thank you.
Berkowitz,
Oh,
Yes.
Butler, Ortiz, Huxley,
No.
Trainier,
Yes.
Winfrey,
Yes.
Newquist.
yes.
Motion carries.
Okay, now we need a motion. Let's get a motion in a second, Julie, and then you can ask your
I'll
question.
make a motion to approve the item as amended.
Okay, can I get a second?
Reiterate the amendment,
Yes.
please.
Okay, so discussion. So go ahead. Sorry.
You leave it on, she won't have to do that. Yes.
Yep.
So the amendment is to add the county clerk to this. We received stipend payments for the county clerk. She wasn't included in this originally. So the total would be 19,500 instead of the 13,000, and it would be three payments of 6,500. The stipend payments come from the state of Illinois.
Rashawn, it's a stipend for what? What is the expense?
So the stipend, each elected official receives stipend payments from the state of Illinois, and that is a part of their duties, payment for their duties as an elected official. Last month, we had 4 elected officials, the treasurer, the sheriff, state's attorney, a couple others. And so these are the remaining. Payments are received in the treasurer's office. These funds have to be appropriated in their budget so that can be paid out.
So when we recently voted on the compensation for, I believe it was the sheriff and the state's attorney,
That- That has
Mm.
nothing to do, that's separate. That's their salary.
so I'm asking, was this stipend enclosed?
No,
Or was the stipend
included.
identified when we were considering that vote?
No, that's separate.
That's
You're
separate.
just voting on their, setting their salary. That has
So-
nothing to do with the stipend.
And we vote on this every year.
Yeah.
Well, I understand, but this is coming at a separate time, and
Mhm.
I asked a question whether when we receive so their compensation, you can say that their compensation, this is increasing their compensation, correct?
No, so it's an added,
Benefit? Is
correct.
it a benefit?
No, it's a payment. It's,
Okay,
yeah.
okay. And
And so
the
this has
money
come,
that
this
we-
is nothing new. This has come before the board last year.
I know, and
as
that's why I
well.
asked the question, let's define a stipend. So this money, the state is transferring it to the county, and this is the only place it can go.
Yes.
Okay, so if we refuse it, what happens? If the board?
Why would we
voted-
refuse it?
I'm not saying I would.
Oh,
I'm sure, just follow me through this.
okay, so
So,
So let me put it to you, let me just say it this way. If the state pays this out and you're entitled to it, and it's a
mhm.
routine transaction that happens every year, why would the county refuse that?
I didn't say it would. I just
Okay.
asked a question. So is this based on a formula, or how did the state determine that this was the stipend that this elected
I
official?
can't
would-
answer that question. Member Berkowitz,
So it's, sometimes it's different. It's not the same.
no, it's been the same amount.
It's been the same amount.
Yes.
Okay.
Mhm.
All right. I'm just gonna, for, basically, this is a addition to their compensation in one way or the other. And I just think that if we're going to be given information or talking about our positions and how much we make, we need to also disclose that in the future.
This was identified when we had the conversation about the
$13,000
salary.
stipend or
No, it's
6,500.
6,500
Okay.
per elected
So that
official.
was-
Yes.
I'll go back and take a
Yeah,
look
go
at.
back and take a look because it definitely was identified. I mean,
Okay.
we don't factor it into, you don't see the total amount, but I definitely
Yeah.
recall it
But
being listed.
I remember the recorder coming even to our
Yes.
caucus meeting and saying how she can't afford, the standard of living is very difficult to afford today. And a $6,500 bump is pretty nice. I know a lot of people who would like that. So where does the state get this money from?
From our tax dollars,
I have no
That-
idea.
from our tax dollars.
That, again, I can't answer that.
Okay.
I would have to go back and
Can you-
research that.
Can you check it out and let us
Sure.
know? Thanks, I appreciate it.
Member Oxley?
I think what Julie's getting at, and I don't recall completely, when we were talking about pay increases, it was mentioned that there was a stipend, but I don't think there was any dollar amount mentioned. I do not know that if there was, and it changes yearly according to this.
My recollection is that there was, and it does not change yearly.
It doesn't,
It's
yeah.
been $6,500 for every year that I've been on the board.
Well, okay.
So,
and I'm
just, but no, just letting you know, it's been the same.
That's why I asked the question.
Yeah.
Because I'm just new. I'm not just new,
Yep.
7 months into it, but everyone has
mean-
the right to ask the question to get an answer. And if we don't discuss it here at finance and we go to the board, we're told to discuss it at committee.
Correct.
So
These
that's
are
why we're
legit-
discussing
totally
it.
Legit questions. I'm just trying to answer it. Come on up, Karen, and then Mr. Butler after. If you would like to weigh in on this, Chuck, feel free. Oh, let me put your thing on, sorry. Where is it? Why? Yeah, thank you.
Okay, so for our stipends for the county clerk and recorders, because we're under one association, our money comes from the State Board of Elections. That's why last year you didn't have to approve ours because ours got missed in the whole thing because everybody else comes out of another pay out of the state of Illinois. But county clerk and recorders comes out of the State Board of Elections. It is set in our state statute. And the last time that they raised their stipends was roughly 29 years ago. So, and the reason you guys have never had to approve this is they used to send us a check directly. And they did something in the state, I don't know what, but they started sending everything to the treasurer. And then the treasurers had to disperse the stipend payments to the elected officials. So that's why you've never had to do this before. But we have had the same amount for 29 years and myself 17 of those.
Okay, so I haven't had time to pull up that, the meeting minutes from when this conversation occurred. So your stipend is included in the compensation amount, Rashawn, that you give us when we're considering increasing their salary? Was that stipend?
I think you're
included?
I think you're talking about increases for elected official pay, correct?
We voted on an increase for the state's attorney with a COLA, I think 6%, was it? 6.2. And then we also voted on,
That-
for the sheriff. But my question is the stipend or stipend, is it included in that compensation dollar amount we were given?
I didn't provide,
or
I
no?
did not provide that, so I would have to see the documentation in order to see if the stipend was
So-
included in the salary.
I just want to ask a couple questions. So the stipend comes from the state, we're not paying it.
Correct.
Correct.
Okay.
Yeah, they're just now sending it to the treasurer
Correct.
instead of
And
sending us
How would
checks
you, is
directly.
the stipend rate gone up?
No.
So it's exactly the same.
29 years,
Correct.
it's been $6,500.
Thank you.
No problem.
Yes.
Give me 1 minute, Dan. Oh, you turned your light on? Okay, we'll let Chuck go and then Sherry.
Yeah, we did include that
And then-
stipend information when you had the discussion initially with regard to the compensation for county-wides. So what I'll do is I'll go back and I'll add, or I'll find that piece of information that we sent out to you. I'll get that report and I'll send it out to the committee again on that, so.
Sherry, go ahead.
So I have been appointed to a county officials compensation task force by the state. And they are reviewing these stipends at this moment, whether they will continue, if the state's gonna pay more of a part of it or whatever. We've only had 2 meetings so far, so I'll be informing you of whatever we come up with from the task force. But the state has actually developed a task force to review these stipends, and I am part of that task force.
Okay, thank you. Judy, I'm gonna let Jackie go and then go ahead.
I just wanted to add to the conversation, as far as the state's attorney and the sheriff, and you guys can correct me if I'm wrong, but the state has set their salary amount.
Correct.
We have no control
Correct.
whatsoever over that. Now, her committee that she's serving on may be discussing that and they may make a change. But at this point, those 2 salaries, we have no input on. The only salaries we voted on were the other countywide elected officials. I can also add in why they changed the process of how they send you that 6,500. Just, I don't know if this specifically is the reason, but at the township, the state sends a bonus to the township assessor if they meet certain criteria, and they send it to them directly. And the problem was they didn't take out taxes. And most townships use a pretty rudimentary form of accounting. And that system, and I'll just say QuickBooks for lack of a description, didn't have a way to pay the extra taxes out of their check if that 1,000 was sent directly to them. So I think the reason the state is now sending it directly to the treasurer's office is so the appropriate amount of tax money can come in and out of a payment as needed.
Okay.
And I think that's why they changed it. That was the conversation I recall hearing at the TOI meetings,
Okay.
Township
Thank you.
officials of Illinois. So hopefully that
Judy,
helps.
did you have a question still?
The only stipend that we pay with county is to the county executive because she's the liquor commissioner. And so there wasn't, the county executive, is only couple counties, and we did it right. And then we just did that so that she would get a stipend as well. He, whoever is the county executive would get a stipend as well. The rest of the stipends come from the state, but we pay the county executive. So she's the only one that we pay. And we just match whatever they did at the state.
Thank you. Okay, anybody else? All right, we had a motion and a second. Can we get a roll call again? Oh, oh, that's not right. No, let's try that. There we go. Thank you. Wait,
Update this and bring it back.
no, because we made the amendment. So we're voting now on the amended resolution to include the clerk's stipend. Go ahead.
Berkowitz,
Yes.
Butler,
Yes.
Ortiz, Oxley,
Yes.
Trainier,
Yes.
Winfrey,
Yes.
excuse me, Newquist.
Yes.
Motion carries.
Okay, thank you, everyone. Thanks, Rashawn. Other old business, I have none. New business, we have a presentation about the financial grant, about the financial impact of the grant reductions on the health department. Thanks for your patience. Let me, if you could hit your mic buttons so I can.
Do we have this presentation printed out, Chuck?
It's on.
Okay.
I know, but we can't make notes on this new system.
Right,
Okay, go ahead, guys.
great, excellent. Good afternoon. Oh, Good afternoon, almost in 2 minutes here. I'm Elizabeth from the Will County Health Department, and I am joined with by Denise Bergen, who is our Assistant Executive Director at the Health Department, and she was the former Director of Finance, and also the Director of Family Health Services, Sylvia Muniz. And in your packet, you did receive a PowerPoint, and you also received an impact statement that provides more information regarding the programs and the staff that are illustrated in the PowerPoint. And I will be handing out also a letter of support signed by our Board of Health members supporting this request. So thank you again for allowing us to present to the Finance Committee the impact of our grant reductions and the Will County Health Department's request for additional levy money to support critical positions in our Family Health Services Division. We appreciate your time, so we will get right into it. As stated in the impact statement, public health has been underfunded for years throughout the country, and so there's no difference in Illinois. And during the pandemic, we realized as a health department that we were extremely short-staffed. And so we did scramble to hire temporary, part-time, and full-time people to fill the needs and to respond to the pandemic. And we quickly realized that a lot of those positions we probably should have had in our agency to begin with. Our funders also realized this, and so in addition to some of the COVID grants and the ARPA grant, we received additional grants before, during, and after COVID, such as the Respiratory Surveillance Outbreak Response Grant, which continues the surveillance and outbreak response for respiratory diseases. We also received Strengthening Illinois Public Health Administration Grant, which was to assist local health departments in building the workforce, recruiting, and retaining staff. Then we also received Disease Intervention Specialist Workforce Development Grant, which was also to strengthen the disease intervention specialist workforce to expand local health departments and make them response ready. Unfortunately, none of these grants were recurring. So they allowed us to build up this wonderful workforce, but only for a short period of time. So our county has an amazing health department and community health center. And of course, we want to continue the service at the level that we're providing right now. We want the county board to be very proud of our health department. That's why we come here every month. We ask you to meet our staff. We bring our staff. We have you tour our buildings because we want you to know who we are and what we do, because that gives you a better understanding of us. And over the past few years, we have made significant improvements in the health department and the community health center, including, especially in the Family Health Services Division, with the services we provide and the number of people that we impact. And we would like to maintain the services at that level. And we know, and we've always complied with, when funding ends, the staff or the program goes away. And we did just have 2 eliminations of positions just within the past 2 months, one in emergency preparedness and one in family health services in our Well Women program. However, we are here requesting additional levy money to retain some of the critical staff that were added to family health services. As quoted by the National Association of City, County, and Health Officials CEO, she said that the pandemic showed what a stronger public health system could look like. Public health threats aren't going away. They are returning to an even more weakened system, just as chronic health challenges, opioid overdoses, maternal health issues, and future outbreaks demand more, not less, of our local public health workforce. Public health takes all of us. It's for all of us. It is local, it's regional, and it's collaborative. So I am here presenting, and I would like to turn over to Sylvia to go through her PowerPoint and the impact statement. But first, I just wanted to quickly pass around the letter that I had mentioned. So you can take it. So Sylvia, introduce yourself, please.
Oh, let me hold on one sec. There you go.
Wonderful. Thank you. Thanks, Elizabeth. My name is Sylvia Muniz, and I am a master's prepared nurse here at the health department with nearly 30 years of experience. All my experience is in maternal child health, and I have been with the Will County Health Department for 10 years. Prior to that, I worked in NICUs in the Chicagoland area. So the slides, I'll just kind of go through the slides with you a little bit and elaborate on some of our concerns here. Family Health Services Division is a division within the Health Department that can be essentially divided into maternal child programs and population health programs. So our maternal child programs include WIC, our immunizations program, thank you, our Better Birth Outcomes, which is our high-risk case management program. Our Better Birth Outcomes program provides services for high-risk pregnant women and high-risk infants. And this risk is anything from a medical diagnosis like diabetes to diagnosis during pregnancy, perhaps preeclampsia, a placenta previa. Bleeding occurs and complications can occur. Our high-risk infants are premature, and prematurity is born before 37 weeks. So kids, you know, they're rescuing babies at 23 weeks. 23 weeks are like a less than a pound. Okay, so let's picture that. And these babies have a long length of stay in the NICU, which then creates a burden on the family financially. And you don't like to say it this way, but the lifelong impact is severe. Okay, so our programs, our goal is to prevent this, prevent preterm deliveries, prevent complications during the pregnancy so that we can curb that and eliminate some of that prematurity and cost that happens. And we do this with our nurses. Our nurses provide education, they provide support, they do home visits where you can actually see the big picture and what is going on. And within this program, we actually see about 1,100 people a month. And, you know, they're not all home visits every month, but we are contacting these families within these two programs, within our DCFS follow-up program, where we provide medical case management to these children to ensure that they're getting their needs met while they are in foster care. So our concern is that when we reduce services in these programs, you're going to have higher rates of preterm delivery. You're going to have higher rates of maternal mortality and morbidity. We're going to have longer NICU stays, which leads to a greater cost. And then that's just an immediate impact. Long-term is these babies require then additional specialty visits. Maybe they have retinopathy of prematurity that can lead to blindness. That's a lifelong impact on this one child. So those are kind of just within this program, some of what we are looking to prevent from happening. A couple of quick stories. We had a mom in our BBO program, Better Birth Outcomes. Our program teaches repetitively signs and symptoms of preterm labor, signs and symptoms of preeclampsia, postpartum complications, signs of that, and KICS count, fetal movement. And our nurse had taught this mom, you know, to check her fetal movement daily, same time every day, just relax and see what's going on. And she felt no movement. So she reached out to the nurse. May, I'm concerned, I'm a little scared, my baby's not moving. She needed that validation from May to tell her, the nurse, to tell her, you know what, go on to the hospital. Go on into the hospital and get checked out. Okay, went into the hospital. Of course, they whisked her right up to labor and delivery. Placed her on that monitor, and they could not pick up the heart tones. So emergency C-section, and out comes a baby with the cord tied around her neck, which thankfully everything turned out fine. This was about 35 weeks, so she was a little bit early. But if mom had not paid attention to her body, if she had not been receiving that support from the nurse, this could have very well resulted in a demise and a death for this family. Okay. Again, that's just one case, one story. Ashley was in an abusive relationship, 19-year-old girl, pregnant, lost her job early in the pregnancy, impacted her ability to pay her rent and utilities. Her abusive boyfriend was not financially supportive, and her relationship with her mom was strained because of this boyfriend. She had pests in her apartment. The landlord was not addressing this. So in addition to the usual prenatal education, this was just support that the nurse gave her, resources which Ashley utilized to improve her situation. Again, she felt empowered. She delivered a healthy baby boy at term, and then she came back and visited the nurse about a year later at her WIC appointment. And she thanked the nurse for all of this. She stated that she had left this boyfriend, left the abusive relationship, reconciled with her mom, moved out of that apartment. She was now working part-time and taking business classes at JJC. The nurse congratulated her. You did a great job. You did all this for yourself. Nobody did anything for you. You did this for you. And she said all she wanted was to give her son a good life. Again, this nurse did nothing. That's a lot of times people think that it's a concern, it's an issue of us doing stuff for people. No, she utilized all these resources, did it for herself. So again, it's just a story of again, providing that validation and empowering these families to go ahead and advocate for themselves. We can go to the next slide about immunizations. Our immunizations program is a core public health program, and we provide a slew of services. We have child and adult vaccination. We created a homebound program. We have low-cost vaccines for uninsured and underinsured, a lot of outreach and education. We have an international travel clinic, which is really a rare find around here. And with these nurses that we have additional in this program, our 2 nurses, our manager, and our clerk, we are able to provide this homebound program. We are able to provide these vaccine clinics in the schools. Just recently, we have partnered with District 86 and Plainfield to get kids immunized. Last year, 400 kids in Joliet School District alone were excluded by that October deadline because they were not immunized sufficiently. So we've had 70 kids immunized in our clinics that we've had so far with these programs. And we are having another event scheduled this week and then another 2 events offered in September. So we foresee that this is going to continue as long as we have the staff that can provide this service. Our homebound patients, this program started during COVID for people that were unable to come in and get their COVID shots. So we were going out into the home, providing them with their COVID shots, and then we expanded that to include other vaccines that were necessary for these families. Again, once we lose all of this staff, we will not be able to provide these services. Basically, our nursing staff will be cut in half, and we will only be able to provide our minimum clinic services in the Joliet office. We were able to expand our appointments in NBO, in our Northern Branch office in Bolingbrook, and in our Moni office because we have additional staff. Next slide, please. Oh. Our communicable disease program is composed of communicable disease investigators. And these are the staff that do just that. They receive reports from Illinois Department of Public Health of diseases that have been reported by medical providers, hospitals, and then they reach out and conduct their investigation, which includes contact tracing, surveillance, insurance that they are getting their treatment, that they are meeting their follow-up. Again, with the goal of mitigating spread, of minimizing morbidity and impact. And we currently have 4 investigators that we stand to lose, which would be half of our staff. One of our biggest programs that we would lose with a decrease in staff is our infection control. We have a certified infection control specialist on our team that works with long-term care facilities and congregate settings like schools to minimize and mitigate spread, prevent spread of infection in those settings. And if we lose all of this other staff, we will not be able to provide that programming. So the impact can be significant, again, unfortunately. Our next slide, please. Thank you. Our HIV and STI program has greatly expanded with the addition of our nurses and a manager. And this manager, they've been able to provide additional outreach activities. They are increasing their testing sites. So with that, we're getting people sooner into care quicker. and allowing for, again, decreasing the spread of HIV, decreasing the spread of STIs. A quick story, we had a gentleman that came in and actually contacted through a social media account that we have specifically for a high-risk population who was just fearful of coming in for testing. And he connected with one of our staff, Kendra, and she reminded him that, he missed an appointment, but she was still available. Come on in and talk. Come on in, get his testing done, and she would be with him step by step. He finally did have the courage to come in and discovered that he was HIV positive. As he left the building, a more experienced staff person followed up and reached out to him. And he confided in this person that he regretted testing with us because he felt overwhelmed and he felt completely just stressed. Imagine that situation that you now are in for that confirmation. But this person reassured him and encouraged him to continue to come in for additional testing, to continue to come in for treatment. And so he has remained connected with the clinic, the care clinic, the HIV clinic on our campus, and he takes his medication and reaches out to these staff freely now with no fear, because now he has developed those relationships and he can confide in them and reach out for help as needed. When we lose our staff, we lose the ability to reach these people. And it's just significant, and in the manner that this person could continue going on and never know, for example. And so we just really hope that some of these situations are taken into consideration. Just these brief stories of just 1, 2, 3 people that were impacted, and in our one program, we have 1,000. So these are just 3 small cases, and they're small to us, but significant for these families. Questions?
No, these positions are so critical in the battle for public health crisis, and Denise can go through what positions are going to be eliminated because of reduction in grants or the non-recurring of grants. So we definitely want to make sure you know that. So Denise, would you like to just talk about that? I'm going to pass this around.
So when we look at these 4 core public health programs, right now we have 15 staff members who are at risk. We are seeking to retain 11 of these positions, and the cost is $1 million for the 4 programs together. I am passing out detail. Now, I have not included the last name or the position of the staff member. Again, there are 15 positions at risk. We're seeking to retain 11. So we do not include that information. And it is detailed on each of the slides, the staff and their positions at risk, and then the number we're seeking to retain, FTE we're seeking to retain.
I just have a quick question, if that's okay.
Of course.
Are all of these grants sunsetting basically, or is this a worst case scenario?
So right now, when we look at our state fiscal year 25 grant awards that have come in, we're facing a reduction of $283,000. Some of that is grants that have gone away. We've laid people off. Some of it is reductions in the federal pass-through amount the state is receiving. In addition, we'll be losing our disease intervention workforce development grant of $100,000 and our respiratory surveillance and outbreak response grant of $500,000 is due to term at the end of July.
Okay, so basically all that adds up to almost $1 million.
Correct. And in addition to that, right now we have ARPA funding many of
Right,
these
which we know
positions
is
as
not,
well.
going to be
Exactly.
duplicated. Okay,
Exactly.
thank you. I really appreciate the extremely detailed information. Does anybody have any questions? We're not voting or anything on this at this time. It's just an explanation. Okay, Julie, go ahead.
Elizabeth, at the last meeting, I had asked you for more information regarding the population base for the grants, the Well Woman grant, and the other programs that we have. I'd still like to get that information. I'd like to know who our population is. I have one report you sent, but it has numbers on it. It doesn't have any of that information.
All of the information you
Oh.
requested was submitted to Chuck, and he indicated that he passed it along to the entire.
Well, I have a report. It's got a lot of numbers and it's got a couple columns, but there's no population information.
We could go through all of this with you offline.
My suggestion is that we have we have a meeting, and we specifically talk about this and be able to ask questions and get the information. If we don't have it today, I'll ask it again. I'd like to know what's the information on the population base for these grants? Where does the grant money go? Does it go to, and where are they located? In what part of the county? I know so many of my constituents are not even aware of our county health department or its services. So if the Well Woman grant, if you saw 300 women, are they women? Are any male? Where do they live in the county? More information. Numbers to me don't mean anything.
Okay,
I
you
can't.
specifically asked for the budget. We did give you the budget. So the
Yeah.
Well Woman Grant is really to promote women going to get their physicals, and they don't have to come to the health department.
So again,
They can go
I'm
anywhere.
asking for that I want a snapshot of who our patients are.
So are you
How many
looking,
women have we served in the grant?
and
with
which
the grant?
program are you,
Woman.
which program?
Any of our grants. We spoke about, and I can listen to the meeting again, but we spoke about
Right.
wanting to be able to understand where the grant money is going. So part of the ask was what is the population base? Are 200 people receiving benefits from this grant? Are 300? I'd like to know what part of the county. Are we reaching District 10, District 11? I'd like that information.
Right. No, I understand what you're requesting. I'm just trying to isolate which grant you're requesting it
All of
for.
them. No, we want.
We have
this
over
for-
30 grants.
Okay, then whatever grant is in jeopardy. I mean, I think we should be able to get that for all 30 grants then, if we have 30 grants. So that's my request.
Okay.
I would also like to say that we had a conversation again, if you listen to the meeting, about how the policies of the state government bringing people here to Will County, which I believe is part of we don't have information on how many of our patients are undocumented. I'm told we can't ask questions, but the state policies are driving this. And I know people who have told me that it's more difficult to get into our health department now. It's very crowded. They've come regularly and they're having trouble getting appointments. They have to wait longer. We need to ask the state for more accountability. If their policies are driving more demand for services here in Will County, they need to contribute more to that. And we need to hold them accountable. And we have that voice to do that. If we can go to Springfield and say, we've seen this rise in the demand of services from this population base, and I think, I don't understand why we can't ask or get information on the population base, why that would put us in jeopardy. So
I'm not disagreeing with you, but we did specifically ask them for budget numbers for today.
Well,
And so I think that,
I have
you know.
also asked for this, so I'm asking for
But
it
did
again.
you ask for it in finance or did you ask for it in health and safety? I'm just asking because I've not heard your request before. so-
I'm not sure. There's so many.
Okay.
committee-
Well, I know, there's a lot of
So,
committees.
Ms. Berkowitz, I do apologize if we didn't provide you with the information you requested. I thought we took detailed notes, and we did send all of our grant information along with the split, whether it's federal or pass-through or state, along with what the grant is. and the budget for Well Woman. And then we also provided all of the information regarding the Vaccine for Children program. But of course, if we did not get you what you needed, we can get additional information if it's available. Specifically for Well Woman, it is a program that we encourage women to go get their physicals, go get their mammograms. So they don't have to come to the health department. So we may not have information on who we actually impacted because they could have gone to their own provider.
And the other thing, this was part of the conversation. We asked about the dollars that are spent for social media.
Yes.
How much, which I think you just referred to, how much of the money are we spending on social media? And again, apparently that's not necessarily bringing people into our clinic, but I don't think, $200,000 spent on social media today is maybe we shouldn't do that. Maybe we should actually spend it in the clinic.
Yeah, we also have grant deliverables. So this grant, the deliverable was to actually do social media to encourage women to go get their Well Woman. So we have to follow the grant deliverables.
And the grant deliverable is stated by the state specifically, certain dollar amounts? Do they state dollar amounts?
No, they don't state dollar amounts, but we have a percentage. And then we also have to submit them with a very detailed budget, which I did send. If we deviate from this budget that's approved, we have to go back to the state, tell them that we would like to deviate. They would have to then reapprove it, and then we can move forward. So it is very, very specific with every grant on how we spend the dollars, and we can't deviate from it. And it has to be in accordance with the grant deliverables. I'm just speaking specifically for the Well Woman, for the media and what this grant was in regard to, but for every grant, the
I
same
was
thing is
gonna
with the
say, I'm
budget.
assuming every grant has their own requirements.
Correct.
Maybe at some point, this is something that might need to be addressed in a
I
broader
just-
context.
I just had the ask.
Yeah, of course.
Can I repeat it again?
No.
Yeah, you would like the
Okay.
budgets for all of the grants that are
I like
pending,
the
basically.
population.
Served. Do you want the target population or the
Yeah.
population?
I
served?
think it would be helpful for our committee, because we have had the conversation. How many women or children, or families, or males do these grants serve? How many patients? Women or patients?
Or at least for these programs. So see right here, immunization services, vaccines provided, children, 5,276. Adults, Well Woman's not in here. I mean,
Okay.
this is just
So they're-
broad, this is just broad
Yeah.
categories, Julie. It's not, this isn't specific grants, it's
I know.
broad categories.
So I'm asking about the grants that are at risk of being cut.
So our Well Women grant, that has been eliminated. And again, that was an education grant. It was to promote Well Women's services in the community. As a local health department, we don't have to provide the service, but we need to make sure someone is providing it, and we need to promote the service. So that was the purpose of that grant, to educate women, to remind them to get their annual exams. So that was the purpose of that grant. It wasn't a direct service grant. With respect to immunizations, we can certainly provide the zip codes of our clients. With respect to HIV, STI, now that one's going to be a bit different because
Dan, one
for
second.
privacy indications.
So let me ask, do you have a specific amount that you are going to ask the county board for?
Yes,
Correct.
it's in here.
Yes,
It's
right.
all listed in here.
And it's the
It's
sheet that
a
we
sheet
passed
just got
out.
Passed around.
It's 1 million,
Right.
but does this include your budget for the year? Is this on top of the budget for 2025?
This will be
It's in
built into
addition.
the 2026
It
budget.
Right.
was
correct?
26
This is-
budget, not 25.
Right.
This is our request for 2026 to retain these 11 positions under the core public health programs.
I'm just trying to get back to my, my meeting portal here, because this is really kind of.
Maybe the handout. The handout might be easier to.
Does anybody else have any more questions? Oh, sorry,
There,
Dan,
thank you.
didn't see that. Let me, give me 1 minute here. Okay, Dan, go ahead.
Okay. So I get that. We're looking at next year's budget. We're good for this year, but next year we're gonna lose a lot of positions, so we're looking to keep those covered, okay? Because you found a great need for them that you didn't necessarily understand before. What I'm wondering is, what about for social services, like workers in social services? How are you staffed there? Like-
What do you mean by
Like
that? I'm
for
so
your
sorry.
people that handle, people with mental disorders or, family problems, stuff
Oh,
like that.
our behavioral health
health?
division?
Yeah.
Correct. So that is a completely different
I'm sorry to
division.
Change the subject.
Okay, no, you're fine. No, that's fine. So, as you know, we are funded through grants, fee for service, and we also did get some levy money from the 708 Mental Health Board that asked us to expand behavioral health services.
So you feel like you have a robust staff, like that can handle a little bit more?
So we have expanded services significantly in behavioral health. We've also expanded our services at our North Branch office and in our school-based systems.
I'm just asking for some other project that's coming up that I just wanted to get an idea of, how well you had that, I say manned, but how many people you had staffed there to see if they could handle more work.
Yes, we are. I mean, behavioral health is beefing. They are hiring more people. They are anticipating more clients. We're in more schools. So,
I'm sorry, I don't mean to be cryptic. I didn't know how much I could talk about it, but I just wanted to say, I know that the city of Joliet has to deal with, I forget what it's called.
For each,
But
that's
for
what
first
their
responders that
request.
to go in,
Each
they can
grouping
hand it off to
comes to
like,
what I'm.
some of the social workers or whatever, behavioral science people
They don't hate-
to
they
help
don't hate-
eliminate some of their time so they can be
They
freed
do.
up. So I was just inquiring as
Yeah,
to
we don't-
how well you would
we
be
don't
staffed to
control
help
that.
something like that, if
We're
we
just
did it on a
saying,
bigger scale.
yeah, well, we would have to assess all that. I mean, we meet with our local partners and figure out the needs in the community all the time. And Dr. Burke is here, and we also have a representative from behavioral health, Michelle Zambrano. But right now, it seems to be the school-based systems that are really asking for our expansion. And so that's what we're focusing on. Our Bolingbrook office, that's where they're looking. They've asked, for additional services out in the northern end of the county. So that's what we're focusing on. But of course, if some other entity came to us looking, could we partner with them? Of course, we would assess that and see if we could handle that and if we would need additional staff or if we wouldn't. I really can't anticipate right now.
Okay. Thanks.
Okay, Jackie
Yes.
and then Dawn.
Thank you, Chair Newquist. Great job, ladies. This is going to be a big deviation if we go this route from our normal process. I've been here 17 years. We do not keep projects. When the grant money goes, the project goes, and that includes the employees. And I know you guys have been very resourceful over the years in trying to find other places to put those folks so that we don't just like cast them out onto the street, which right now it seems like there's a huge purge in the federal government, putting people on the street. And it certainly affects our overall economic growth in our communities. I love what you've been doing with these grants. I'm very happy about the school-based needs being met because that is an area where we have a lot of need. I did note that there is going to be a new process, and I don't know how long, is it JCAR at the state level, takes to review legislation and come up with the rules. But the new thing is now there is going to be some mental health screening in the schools. And I can already know that the schools don't have the money for that either. And I don't know if they're going to be asking you or through the mental health board, asking the board to help fund these things. I really want to find the $1 million. Whether or not the whole board has an appetite for that, I don't know. But you've certainly presented a really good case here for what you need and why you need it. And, if you get us a few more details, that'd be great. But if you don't, I certainly understand where you're at. I read the whole packet over yesterday and I know how important this is. And I know, at least in my district, what the needs are in the schools, and they are huge. And there's a whole host of different reasons for that, but the problem is still there. And if we can find a way to address it, I'm all for it. So maybe we can get a little bit more money out of the mental health board. I don't know. Maybe their levy needs to be looked at again, and maybe that'll be a partial solution.
And not to
No,
deviate from
please.
that, unfortunately, money has to be used in accordance with what it was designed to be done. So any additional money from the Mental Health Board would go to the Behavioral Health Division.
And are they covering the whole behavioral health division right now?
Oh, no.
But
So-
if we did, that would free up other money in your levy.
There's not a lot of other levy support in behavioral health.
Okay,
Yeah.
that's what I'm trying to
But
get to, whether or not there's any
Right.
more wiggle room there, if there's something that would help.
We've wiggled.
Okay. I've watched you all dance for years now. And most of the board members here, except maybe member Winfrey, and member Williams, because she was the union rep, recall the dramatic cuts that were taken between 2008 and 2012, and they were huge. And we've now kind of, I think, gotten back up to where we were. And I'd really hate for us to repeat this cycle again, because it just does seem rather ridiculous. But that'll be up to my fellow board members and the levy. So thank you very much.
Yeah, our concern is that we just want to be prepared to, for the next thing that comes. We don't want to have an even more weakened system.
Absolutely, I totally agree.
Dawn, go ahead.
Hi, so question because I'm, as we're told, we're new, I'm new. And I just want to know, so if you obviously don't want to go down the road of cuts, I completely understand that. Also, well, there's no telling what's going to be in our future, right? Do you, as the Will County Health Department, when you cannot meet someone's needs or they can't get an appointment, or, if there is this backup, do you refer out to agencies out there instead of, just trying to handle it yourself? Like,
Of course.
and if you, I'm going to tell you why I'm asking you this. I've been on the United Way board. I've been on their allocation committee, and I know there are agencies out there. Agape is the one that comes to my brain right now, who deals with the STDs and
HIV.
HIV
case
HIV,
management.
yes. So help me understand, how many of those people, agencies, do you reach out to? Do you work with?
I can just give a little bit before you jump in. So we have MAP, which is Mobilizing for Action Through Partnership and Planning. And we have over 80 partners in MAP alone, which are our community-based organizations, our hospitals, and our partners. But we also have IRIS, which is a referral system with, 100, maybe
Over
over 100 different entities that we can refer out to. And I'll defer to Sylvia to talk more about IRIS and how
Yes.
that works.
It is an online referral system and it's closed loop. So if you refer Denise to Elizabeth, Elizabeth receives the referral and then you will get a response whether or not that referral came through, whether or not she was enrolled in the program. We have 100 community partners within IRIS to refer to each other, and that ranges from early childhood programming to police departments. So it is a very robust, just community partnership throughout the entire Will County. And that is one of the things we do pride ourselves on, is having those partnerships and building from there. In Agape, we have an excellent relationship with Agape through our HIV program. Our HIV program prevention program is stellar. It's exemplary in the state, and it's expanded with the addition of the infectious disease doctor at our community health center. So we are able to provide HIV care and PrEP services there. Excuse me. So it is really impactful in that respect.
And it's also our health equity team. Our health equity team is out in the community. At this weekend, they had 3 events on the same day. So they divided and conquered. So we are out in the community. And what our health equity manager knows and does is if he knows all of our programs, so does his staff. And he also knows the connections to other community-based organizations that can handle other programs. So he is a wonderful resource too. If he comes across an individual that needs something that he knows that we cannot provide, he links them with those community-based organizations. And that's one of the amazing things that our health equity team does. So just to add to that.
Thank you. So I have a question. If we did not fund the positions that you're asking for, are there other community organizations that have the bandwidth, so to speak, where if we ended up providing referrals instead of providing this service ourselves. What's the, I guess what I'm asking is how realistic of a scenario is
Yeah,
that?
so I'm going to defer to Denise because what we did several years ago is we do what we call a program analysis. So anytime we're looking at a program, we look and see how much it costs us, how much staff, and who else does it in the community. And so if we have to eliminate any programs, and we've already talked to our Board of Health about this, that we are going to do a strategic program review, strategic plan is something else, strategic program review of every program that is at risk to see, do we need to retain it and just, we have to cover the cost because nobody else does provide it? Or can we work with another entity? But Denise, you can. fill in
Right.
the
No,
blanks.
that's one of the things we already talked to our board about. We're looking at a kind of a different environment in public health, and we're looking at all of our programs, not just our programs at risk. And we will be undertaking this in the fall because we're really waiting for additional information from the federal government, because not only is it affecting us, but it's affecting so many of our partners. So we're not really sure who's going to be left to provide the services. But that's one thing. As a health department, again, we do not have to provide everything. We have to make sure someone in the community is providing it. So we'll look at the expenses, the revenue, the number of people served, and the other organizations that do it. And then hopefully this will be a roadmap letting us know where we can cut and where we're the only show in town.
So for these positions that you're requesting to retain, have you done that analysis already or not yet? It sounds like you haven't had the
Right.
information.
We really
We're
haven't done that because these are our core public health programs. As a certified local health department, these are services which we are mandated to provide to the community.
Okay.
So that's why we are seeking really to preserve these 4
Got it,
programs.
because they're mandated. Okay, thank you.
Exactly.
Jackie, give me one
Yep.
second.
Can I just follow up really quick?
Sure, go ahead, Dawn.
I just want to say, the communicable disease situation, I don't feel that's a federal priority. So if that is like one thing I want to see us put our money behind, because if we don't know what's going on in Will County, Illinois,
Yeah, and that's core public health.
That's-
Food, water, sewage, and communicable disease is required of a certified health department, which we are, and you want us to be certified health department. So we can't lose that program.
And we understand it is a big ask,
Yes.
everyone in the county is facing the same thing, even the people we serve, which is why we've given you detail on how much to retain each program. We just wanted to give you as much information as we could.
I just have a
Go ahead,
follow-up.
Jackie, and then, Jackie, then Judy, and then we gotta
You
wrap it
mentioned
up, guys.
Iris, and I know when I was working at the township, our general, our GA guy had talked about, oh, Iris is back, because I guess maybe it was gone for a while. Maybe he thought it was gone in his other job. I don't know. My question is, how widespread is the access to Iris? Does every township, does every municipality? Who gets in the loop to make referrals to Iris?
Anybody in Will County, once we, if they reach out to us or we reach out to them via other partners, that is how they get in. So it is currently.
Because you
it's
said you
in-
had 100 partners.
Mhm, within Will County.
Yeah.
Mhm.
Is there a list somewhere? Can I get one?
Oh, yeah.
Okay.
Yeah.
Yeah, that,
Absolutely.
I'm very curious about that because I'd like to know that people from all over the county are accessing this and asking those questions. for,
It started off
questions.
as an early childhood, like a 0 to 5 base, and then it exploded from there. It's been around since February of 2020. It hasn't gone away at all. So,
I think maybe he was talking about pre-February 2020.
oh,
Maybe that was the.
yeah,
situation.
no.
I didn't pay that close of
Yeah.
attention. But, it was something that I thought, oh, this is really important because this is how you network. If you don't know the provider, this is a way to find a provider.
And I wanted to clarify really quickly what the health department, a lot of people generally consider the health department just the community health center. And we are like ginormous compared to that.
Yeah.
Community health center is just one division within the health department. So all these other services are outside of the community health center, which is the medical provider that we are bringing today. So.
Right, Judy, and then we'll finish up with Julie. Oh, and Denise, you haven't spoken yet. So Julie, then Denise.
Thank you. So I know that Elizabeth, I'm not sure if you were here when John Cicero was here. Were you here with John Cicero as well?
Been here
Oh, yeah.
35 years.
And she was here. So there came a time years ago, and there are a couple board members that were here at the time, that John Cicero did do the exercise of going through all the services and programs that we have and determining whether they still were providing the function that they were supposed to do. Many of them started with a grant program, and it turned out that eventually, the grant dollar stays the same, 75,000, whatever the number is. And eventually you hire an employee, maybe two, to do it. And eventually over time, their salaries increase. That the most of the grant dollars are now funding the salaries of those employees, and therefore not able to have a lot of money left over for services. Or the community now has picked it up because we do things first, right, at the health department. And then the community will pick up programs and services that after the fact that they find that there's a definite need, and, insurance will pay for them. So there always should be a great analysis of what we have, who we're serving, and whether we need to continue at that or not. And it's been a long time since John was here, and he went through that exercise, and quite a few things were eliminated because we found that, well, at one time we served, I don't know, say 100 people. Now we're serving 4, and they could easily get that same service somewhere else. So that exercise would be a good exercise to do, regardless of what the future holds. No one knows what the future holds. So we should do that exercise and see where we can cut. And then possibly by doing that, we could provide this other. And granted, nobody wants to let anybody go, but you're hired under the grant for the specific purpose of the grant. And if the grant is no longer serving that purpose, then your role is ended.
Correct.
It's
That's
just-
what our strategic program analysis does. And we did it several years ago with Sue. I don't remember the year, maybe 2016.
That we did lay off
Yeah.
in
There were big
20
layoffs in
2015 and 2016.
Right. And so that is, it's unfortunate, but it's just the way it ends up going, and it happens in everywhere that somebody's an employee. So I'm glad, I look forward, you guys should do that so that we have a good numbers to look at. Thank you.
Thank you.
Thank you. Julie, go ahead.
Thank you. So the list of these positions, are these the positions that will go away with the grants?
Those are the positions under core public health that we are seeking to retain. Those are
And they're
not,
currently grant positions?
they are grant, they are ARPA, they're a variety of
Okay.
different funding sources.
What I wanted to ask you about is, okay, there's a salary, FICA, IMRF. So each one of these positions, these people are now in IMRF.
They are full-time employees.
Okay, so they are in IMRF, and for each one, it cost us, so for number 118, it cost us $6,803. Is that annually?
So IMRF, the percentage is calculated annually, and this is based on what is budgeted for county fiscal year 26, and I believe it's 9.17%. And then we're also going to have a $500 increase in group insurances for 26. These are costs that the health department we absorb. So we have over 300 employees times 500, we're absorbing $150,000.
So part of the stipulation of the grant is that these people, they are full-time employees and they get IMRF benefits. And what does group mean? Group, okay. So let's just say their termination ends. I'm not saying they will. They are now in IMRF because that was part of their employment. Does the county have to continue to pay IMRF, or who pays that eventually because they are now in the system?
So we pay while they're.
Oh, I'm sorry. Thanks. I didn't notice. Thank you.
Employees, sorry. As full-time employees for Will County, we're required to follow the same payroll
Bless you.
guidelines as all other county employees. So they are full-time employees. As a full-time employee in Will County, they are entitled to IMRF. We would pay that benefit for them while they're employed with us. Once they're no longer employed, we do not fund any more of their retirement.
Okay, but then let's move on to 62, they want to retire, or 65.
Okay,
Who's
it's
paying?
Illinois Municipal Retirement Fund. Any retirement they would receive would be
Okay.
from the IMRF.
So after,
At the
if
s-
their termination were to end, the Will County doesn't pay any additional dollars in any way to IMRF?
Right, that is correct. Our liability ceases when they're no longer an employee.
Okay, I just wanted to make that.
Now,
clear.
the only difference, of course, would be if they're a long-term employee and they're under 65 or 67, and they are eligible to carry insurance for themselves until they are Medicare eligible.
So does that mean they can?
You have to
they
have
can-
so
We have
many
to provide
years.
Cobra? Is that what you're?
Mhm.
Yeah.
Right.
Okay, state that over again.
Okay.
Because it kind of,
So when you work for Will County, if you have enough years in and are eligible to retire and you are under Medicaid or Medicare age, Medicare eligibility age, you are eligible to receive county-funded insurance until you qualify for Medicare benefits.
okay, and
have a separate
that's
fund
part of
that-
this IMRF.
No,
No,
that's
No, it's
completely
part of-
separate
okay.
from IMRF.
Okay.
IMRF is just the retirement account.
Okay, so that would be under the group.
Exactly. So the
Alright.
county has a percentage they pay for employees, and the individual also contributes a percent. Once employment ceases, there is no responsibility or requirement under IMRF.
Okay, so these individuals, if they're under Medicare age.
I'm so
and
sorry.
We don't continue their employment.
Mhm.
Do they, as far as health insurance goes?
So I will tell you, these are short-term employees.
Yes.
So
These
they're
have
not
been here a
long-term.
few years, so
Okay,
we
so
will
these
not
are
be
all
funding.
short-term. Thank you.
Exactly.
Thank you. Denise, did you have a question? You need to hit your, yeah, sorry, it went off. Okay, go ahead.
Thank you. And thank you all for being here and I found the documents, these that you passed out today and what was online extremely comprehensive, as it always is. And I appreciate that and I thank you for that. My only question is the 1 million really enough?
We,
Does it really get us where we need to be as a county?
yes, I'm going to say that, we've looked at our programs because this is
Oh,
core public.
I'm sorry.
Oh, I'm sorry.
That's weird. Why do they keep going off? Okay, go ahead.
This is core public
Thank you.
health, and we did review the positions that are going to be eliminated. And we feel that we have a very good program right now in family health services and in behavioral health and environmental health and all of our programs. And this is all that we are requesting at this time.
Okay. All right. Thank you very much, you guys. Really appreciate it. All the information, extremely helpful. Okay, moving on. We're not voting on that, it was just an informational. Okay, number 2, appropriating state of Illinois grant funds in the sheriff's budget. Can I get a motion? Do we need a clean roll? I think Mr. Oxley's not here. We need a clean roll, probably. Go ahead. Oh, I'm sorry. How am I not seeing that? Don't turn it off. Thank you.
Berkowitz,
Yes.
Butler,
Yes.
Ortiz, Trainier,
Yes.
Winfrey, Newquist.
Yes.
Motion carries.
Thank you. Okay, number 2, number 3, authorizing use of contingency funds for the Sheriff Adult Detention Facility. Can I get a motion in a second? And then I've asked Rashawn, thank you. Rashawn, can you? I know everyone's gonna have questions, including myself, so. If you could hit your, Rashawn, okay, you got it. Thank you. Give me 1 minute here. Okay, thanks, guys. Take it away.
So the request before you is the use of contingency funds. The Sheriff ADF is requesting $618,000 to cover their medical services cost. So their budget, they've depleted their budget for this line for the year. And this is just 1 month that they're requesting. So this request is before you now for your approval. Do realize that the available balance in contingency is about 700,000 right now. And so their original budget was 6.3 million. Their request was a little more than that. However, with the balancing of the budget, what was approved was 6.3 million. And I do have Dave Adams and Dora Reese from the ADF if you have additional questions.
Yeah, could you explain how we got to where we are now? And then I'm also concerned this is only 1 month. What about next month and the month after? I mean, if you guys could give us a little bit more detail about why how we used up our budget already. And I understand there's been a change in contract. Any information you can give us on that would be appreciated.
Sure. Good afternoon. Thank you for allowing me to speak on this so I can inform you what the issue is. We have a medical vendor in the jail, as you all are well aware of. 7.25 about annually is what we pay for that. We requested that in our budget last year. What has happened in the past with our previous contract years with the medical provider, there were penalties that we built into the contract when we negotiated it at the sheriff's office to make sure that if they don't uphold their end of the contract, if they fail in some way, if they're late on some things, some benchmarks we've set for them as a vendor, or if they're understaffed, we have a matrix in the contract. It requires a certain amount of staff be on site for a certain amount of hours. If the vendor falls short of that, there was a time where we would bring it up and they would say sorry, and then we'd bring it up and they'd say sorry, and then we'd bring it up and they'd say sorry. So eventually we negotiated in the contract financial penalties to the vendor so that if they don't meet those benchmarks, the county would get refunded some of those monies in an effort to get compliance with what we're actually paying for. Although the end goal is not to bring in those fines. I mean, it's like if you go to a Burger King to order a burger and they say we're out of fries, they'll give you the money back, but you actually wanted fries. You don't want your money back. And so that's the same thing we did with this medical contract was we put those in place to make sure we're getting what we're paying for. The result that we have now is I think that the reason that our request was not approved at the 7.25 is because we were counting on what we've had over the years, which is a lot of penalties come back in. We have improved the operation with the vendor. The vendor is actually giving us what we want. We're getting great service, which is what we need from our vendors. But the downside of that is we're not getting those penalties and fees back, which we have grown accustomed to. So we actually need the budgeted amount that we requested in the contract because we still get some penalties, and I could explain to you what those are, but they're very small compared to what they used to be.
Okay, thank you. But then what happens this is only for 1 month? And this is our monthly bill, correct?
Yeah, so the monthly bill is about $618,000.
Almost $1 million a month.
Yeah, it's a bargain. Everything from the sheriff's department's big numbers, so I apologize for that, but we're always the bad guys as a result. But it is very expensive. It's about $618,000 a month. We have about $833,000 left that was given to us. So we're going to be able to cover September. And so this is for October. And then we would need November. And so we're going to have to figure out what we're going to do about all that. And then in December, it starts a new budget year, which we've requested, again, the appropriate amount for next year. So if what we've requested is approved for next year, it's a 2-month problem we're looking at.
Jackie, go ahead. Let me, sorry about that. Go ahead.
My understanding is that through the Safety Act, we've reduced the population in the jail. So it kind of makes me wonder, are we over-contracting or overpaying for services based on historical numbers? I don't know what the numbers used to be pre-Safety Act. I couldn't tell you today how many people are in the jail versus how many were in the jail 10 years ago versus how much we're paying per month now versus how much we paid 10 years ago. And I think I kind of need that information just to kind of understand Why we have this problem?
I guess I
Because
can.
$1 million seems like a lot of money a month. And I know you didn't say a million, you said 618,000. To me, it might as well be $1 million.
What I can tell you two things, maybe it could bring some clarification. One is it's a new contract that was negotiated last year on the new Safety Act numbers. So these are not based on the populations of all.
$1 million?
No, less, certainly. But everything is going up, including medical care. And you guys know as county board members, the costs for our employees are going up.
For these guys?
So just, I can answer that. Just off the top of my head, they've paid a little over 5 million for the last couple of years for the
It's like
contract.
5.5, I think.
Mhm.
And now we're at 7 and it's not, or 6.3 and it's not enough.
We've added services as well. Something, and it's not, these are not voluntary services that we're doing out of the kindness of the sheriff's heart.
Okay.
These are things that the DOJ has mandated, such as medication-assisted treatment, medication-assisted recovery. So these things were explained last year at the finance meeting, just to kind of get the members to be aware of the increased costs.
One more question. Do
Mhm.
we sign these people up for Medicaid?
We do.
Do we get any insurance reimbursements for these folks? Sounds like
Those
no.
that are eligible, we sign up for, but not certainly all of them. And again, we're required to provide these services,
No,
whether they're eligible or not.
I got,
And I can further tell you that we went to RFP last year to look for other vendors. We had one bidder. This is the one. We had no leverage for negotiations.
in my mind, there seems like there's something wrong with this. I have family members that can't get health insurance, can't afford it. Should I tell them to go get arrested?
We have a very nice jail.
I mean,
Five
it
star.
seems
Okay.
so wrong.
Jackie, do you have another question?
that's it.
Okay, thank you. We have Dan and then Julie.
Thank you. So when you say it's like 1.2 if you add these two numbers up, right?
I
1.2
think the number
million?
we're looking at that we are short is 1,023,000.
Okay, but that's just for the year, right? To get you through to the end of the year.
That's correct. And
So the following year, we'd only be anticipating another million, right? You're not saying 12 million.
we've requested the full amount for next year's budget.
The full
So
amount
we
of the
would not be
contract.
correct.
What? So this includes that?
No,
What is the full amount?
that is the full amount. So just to back up,
The current year.
The current.
But what I'm saying is, what would be the increase for next year? Would it be times 12? Or is it the same amount?
oh, you're talking about the contract year? What will it cost?
Yeah, I'm
cost
just
you for
saying,
next
I
year?
mean, we're not
I have-
actually saying we're $1 million short a month. We just figured this over a couple months.
Next year's contract.
Is that right?
Correct. 7.7 for next year. That's what we've requested.
7.7 million.
Correct.
And before that, what was the total?
7.424.
But you only got 6.3.
Correct.
Correct. But I mean, that's what we asked for.
I know, I'm just trying to understand. We're not talking about $1 million a month here.
That's
No.
correct.
That's right.
We are talking about $1 million.
We're talking about $1 million
for
total
2 months.
is remainder for this year, for
Yeah.
2 months, yes.
Okay, I just get the feeling that some people maybe think we're talking about $1 million a month. And I wasn't sure if that's what you're saying. It didn't seem like it. I just wanted to get it
Yeah, I
out there.
apologize. If I was confusing, I apologize for that.
Okay, Julie, go ahead.
Thank you. Is it possible for you to provide this committee with the list of mandates and what it costs us? You just mentioned 2 mandates from the DOG. I couldn't write it down fast enough. Medication assistance. You mentioned 2 specific things. So is it possible to provide us with that information? I think it would be good for us to understand what you have to comply with and where it's coming from. So any mandates, you mentioned the DOJ, and then can you provide us with those?
I can certainly provide you with those 2, but I can just tell you that we're subject to literally thousands of laws and regulations. in
I'm
county jail.
looking for things that specifically impact our budget. So you mentioned this does impact our budget.
It
Okay.
does.
So if there's only 2, but if there's 4, can you provide us with that information?
I will do an extensive search I don't know if I can get you an
whoever
exhaustive
does
list
the
of
budget
everything we're
would be
subject to.
able-
That,
Okay.
it'd be very
Okay.
difficult.
And then I just had a question about, could you give us a little, description of the largest dollar amount says it's for monthly medical services. The smaller amount, excuse me, is for MAT services. So can you give us some information? What are medical services and what are MAT services?
So medical services encompasses all their physical health care as well as mental health care. If it's
Excuse me.
specialized services, it's, physical therapy when it's necessary, it's surgery, it's ER trips, anything you could think of, just general medical. And the MAT is medication assisted treatment. And what that is that,
Like the mandate?
yeah, so what it is when someone is addicted to opioids, is what we used to do is what called continuation. So if they were currently on an opioid treatment program in the community and they came into our back door, we would ask them, are you addicted to opioids? Are you on any methadone or Suboxone or something like that? I mean, Dr. Burke could address this more clearly than I can, but we would do continuation of those services. Department of Justice, it wants county jails in every state to start what they call initiation. So that's if someone comes in, even if they're not currently on a program in the community, or we begin a program when they come to the county jail. So if someone is using, I'll use heroin as an example, if they just come into the back door of our jail and our nursing staff ask them, are you addicted to narcotics? Yes, I'm addicted to heroin. Would you like to start, or would you like to initiate a medication assisted treatment program? And so we begin that in our jail. So we do both continuation and we do initiation for people addicted to narcotics or opioids. The cost for that is significant. There's this entirely separate staff that is dedicated simply to that program itself. And so it's broken out separately to make it easier so for us to separate the staff matrix from the regular medical care matrix so we can control both. And so that way, not just for clarity's sake, but also if there's the staffing penalties I discussed earlier, it makes it much easier to have, so we don't have nurses crossing back over in both staffing matrix, making it confusing.
Okay, thank you.
You're welcome.
We appreciate that.
Judy, go ahead.
Thank you. I have a couple questions. So the Safety Act was mentioned. So have we seen a decrease in the population in the jail at all because of the Safety Act or not?
We have.
What would that be about?
I would say,
I know it fluctuates, so it's hard
Yeah.
to grab.
and the other thing that makes it a little goofy is, the year leading up to the Safety Act being passed, it was kind of anticipated. I think by the 12th Circuit and both the PD's office, State Attorney's office, and the judges all kind of knew it was coming. And so I think a lot of folks started getting released that year leading up to its passing, and our numbers reduced that final year leading up to it by probably around 100. And then since then, I would say we've come down about 100 more. Those are rough numbers. I didn't come prepared with the exact numbers, but we did come down a couple hundred. What I would tell you is happening in the last probably 6 months or so is we're starting to creep back up slowly. So those offenders that got released for the nonviolent crimes, as an example, a lot of them fail to appear for court, and so they get warrants issued for them. But once they've already been released under Safety Act and they fail to appear at court, the judges are less lenient because they've already proven that they're not reliable, and so they oftentimes will be detained their second time through.
Okay. I was just also curious, have you received any funding from Cannabis, Opioid, or Mental Health Board?
We did get some from opioid that we used for, do you remember what we used that for?
That 200,000 was used for in the jail. So we get money from.
I forgive me, I'm sorry, I can't remember.
Okay. So I mean, that's something I think we should look into, see if we have cannabis dollars available or opioid dollars available, rather than use all of our contingency fund, because we need that in an extreme emergency. I know this is an emergency, but not like an equipment failure or something that we have to deal with. So if we
Sure.
have dollars there, and if we could use those dollars instead, that I think would be a better, I know we have funding, I don't know how much, but we can get those dollars. Right, yeah, so. And then we handle the next year's budget.
Yeah, I just would, with the request that's on the floor for next year that we're not discussing today, I would just encourage county board to fund it fully, because the penalties and fines and fees are not likely to be there like they've been in the past.
But I think that's a total benefit, right? If we have a contract and we don't, and they're providing the
Exactly.
services we want, that's a good thing.
It
rather
looks like a
than-
bad thing today, but it's generally overall, it's very good.
Overall, it's good
Yep.
because you don't want to be lacking a service you need.
Correct.
Absolutely. No, I, for sure.
So I have
Thank
a
you.
question. Oh, sorry, Judy, were you done? I thought you were done, sorry. So I'm really concerned about wiping out the rest of our contingency. So let's say that we said, no, we're not going to allow the contingency money to be transferred. How would you address this?
That's a good question. I have the same one.
So, and this question came up, because we always have to have
Ask
a
it, you
plan
know?
B, right? So, in talking with Jamie, their finance person, I would work with her and look to see where in the sheriff's budget we could come up with these funds, whether if it's salaries that they have vacancies that we could pull from, and then we would come back before the board to do those appropriate transfers.
And Rashawn, this might be funds that are just placeholders right now. We have them and they're there. Okay.
Yes.
Okay, I think that's a great first step. But yeah, I agree. We need to look at next year's budget and make sure it's fully funded. You know, public safety is our key to give them the resources you need. I think it's great to hear that the relationship has improved. And that was the goal at the end of the day, that was the goal. So now that we're there, are you confident that next year they will continue to function?
At this point, I'm confident. Yeah,
100%?
I'm not much of I'm a trust but verify type of person, as indicated by the penalties and fees, but things are definitely, I mean, again, I knock wood, but things are going really well now. We've got a great manager that was hired, that works in our facility, is a great leader of her staff, and she's really been productive, and the morale is good there. We have retention. We talk about retention issues with our correctional staff. It's no different with the medical staff inside jails. Anybody that works inside a jail is a tough environment. And so it takes a special type of character to be able to work a long career in that type of environment. So nursing is a little different. She's very good at managing her staff and keeping them motivated, keeping them happy. And so that's benefited the county. And as you know, and the state's attorney's office could testify, when we have civil litigation, one of the most litigious areas is medical care. And when we're doing everything we're supposed to be doing, and we could show proof of that, that helps us a great deal.
Thank you very much.
My pleasure.
So my concern is, even if let's say we did fund it with contingency funds, we still have one more month that we have to come up with the money. I'd rather see you guys try to come up with the money first, like you're suggesting. And then if we have to fund that last month through contingency, at least we know we're at the end of the fiscal year and we're not going to be hit, most knock on wood, with any other, unexpected costs. So Rashawn, if that's a possibility, I would think that would be the better way to go here. But probably need somebody to make a motion. I don't know how we want to do that.
Motion that we send our
We need
finance
to-
person back to the drawing board to find some money in other places, including opioid and cannabis, because that MAT seems like it would totally qualify for the opioid money.
I know, actually, that's a good question. Do we need that motion? Like, Julie's saying, or do we just need to postpone it?
No, you just made it known that that's your wishes.
Right.
Okay.
You want to just postpone this to next month?
Okay, yeah, because it is a resolution, so we have to, all right, so then we need,
So I'll make a motion and I'll second that.
okay, so motion Trainer, second Berkowitz. Do we have a previous roll? Previous roll and second, Ortiz, Winfrey. Okay, all in favor? Aye. Opposed? All right.
And
Postponed
Rashawn,
it.
I think in the meantime, then you can proceed to look for those funds that are sitting there hiding.
Yes.
Okay, thank you. And do we want you then to come back to the next committee meeting, or is there something you can get in motion before we meet?
If there is a request, it will be put back on the finance.
Okay,
committee.
can you wait?
Hold
Yeah,
on, I need to turn her mic on.
is
Yeah, so we have enough money. We just
Thank
paid
you.
our August invoice. And we
Okay.
have enough funds in the budget remaining to pay the September invoice. It's not till October that we're short.
Okay,
Mhm.
okay,
So
thank
hopefully
you
we have
for
enough time.
coming forward when you did. Thank
Yep.
you.
Thank you.
Thanks, you guys. Appreciate it. Okay, moving on. Number 4, amending the predictable fee schedule for the recorder of deeds as opposed to the unpredictable fee schedule. And by the way, I asked the question in predictables from state statutes, so. Who moved? Denise made him, and Jackie seconded it? Okay. Do you guys want to comment on it or does anyone have questions?
I do.
Okay, go ahead. Microphone, yeah.
Do you?
Isn't hers?
Can you
Yeah, she
describe
turns her own
a
on.
little bit about this?
Oh,
Give us
sorry.
a little more detail.
Yeah, can you
about
hit the,
this?
thank you. Okay,
So we're here today to ask to have our predictable fees revised based on a new classification that was put in our state statute for state and federal documents. And in order for us to change and clarify what our state and federal documents fees are, we are required for transparency to have a cost study done. And which is, we did supply a cost study and it is in the packet and it does explain everything. And with the cost study, it did reflect that our fees should be adjusted across the board for our recording fees and our automation. Just like when we were here about a year ago for our HSP to be done and GIS. So we did have the cost study done and it does show where all the fees, how they have been adjusted.
So the state is recommending these fees?
The state
Is
is,
that
the
correct?
state is requiring every county to have a cost study done to show where our fees are being set.
Being set, where, what, the
How
dollar
our-
amount we're setting.
so you basically reset the fees in accordance with the findings of the cost study, correct? Let me turn your mic on, so, go ahead.
Correct. So our fees are obviously set through statute and then approved through the board for a resolution to be issued. So our fees had already been set. They added the additional classification of the state and federal documents to be accounted for. And so the cost study was done to do that. And we've reallocated those fees per that cost study to change those fees. And we just have to go ahead and put them out for resolution so that they can be approved.
So the state is recommending what the county charges.
The state, no,
homeowner.
the state, they're not setting our fees. The state is requiring us to get a cost study. And the cost study will show what.
Okay, so different counties may charge different amounts.
Every county in the state charges a different amount.
Okay, all right. I do recall when we approved, I think it was last month, there was one of your fees was based on a percentage of the value of the assessed value of the home. Do you remember? I don't have it with me, otherwise I was.
We haven't been to board for any change in our fees.
Yeah.
Okay, I'll take a look at it. I know I have my notes at
I
home. I
would
just
encourage
didn't
you
have it.
to.
Okay, thank you.
Judy, you have a question?
I do. So I wanted to know, so you currently were doing the state and federal documents and you didn't have a fee for that or what?
We did have a fee. It was at a much
Lower rate.
there was such a vast variety from county to county. And some counties charges anywhere from 10 all the way to $80. So the state is now requiring us to show them how we came up with our fees.
Okay, so for these one, because there's nothing, right, what was the old fee and what's the new fee? Do you know what that is?
It's in the cost study part on
Okay,
that
fine.
back page.
I'll look that up. Thank you.
You're welcome.
Okay, thank you.
Any other questions? Okay, we have a motion and a second. Can I get a previous? Second Winfrey? Okay, all in favor? Aye. Opposed? Right, motion passes.
Thank you.
Thanks, guys. Okay, number 5, authorizing the county executive to execute the necessary documents for the delinquent tax program. Can I get a motion?
Second.
Motion Winfrey, second Trainier. How about a previous? Previous Butler. Second Ortiz, all in favor? Aye. Opposed? Motion passes. Okay, thank you. Other new business? I don't believe we have any. Public comment? Is there any public comment? One more time, public comment? Okay, announcements, report by the chair. I have none. Do we need an executive session? No, thank God. Okay, can someone motion to adjourn? All right, all in favor? Aye.